Greetings, ladies and gentlemen. A very warm good morning, all of you. This is Meraj Kidwai, and I hope you all doing wonderfully well. I'm going to speak on to generalized anxiety disorder. Now, generalized anxiety disorder is sometimes a genetic disorder which runs in families of individuals. It can also coexist with other uh, mental health disorders as well, or personality disorders as well. Generalized anxiety disorder symptoms are excessive worrying, excessive fear, or finding unrealistic solutions to certain kind of problems, or there might be no problem, but still you have anxiety. Now, in day-to-day life, people, almost everyone, go through stress, but when it is in excessive in nature or going in extremes, like extreme overthinking, uh, phobias about day-to-day situations, and extreme phobias, extreme fear about day-to-day situations, which in turn also hampers their productivity, or uh, does not allow them to go by their usual day-to-day everyday task or activities, and hampers their activities of the day as well, affects their decision making and thought process, uh, can be they can become violent or aggressive also that point of time, and because of anxiety, and they do not have proper sleep, they cannot sleep. Insomnia is there in the patients of generalized anxiety disorder. Excessive thinking on worrying about general things or day-to-day things in life, uh, whether they are actually that uh, I would say the situation is that is an extreme or not. So uh, basically, what happens in generalized anxiety, that anxiety happens without any kind of a provocation to the patient. So the treatment for generalized anxiety disorder can be cognitive behavioral therapy, CBT, which is a talk therapy or a psychotherapy by a clinical psychologist specifically, or a psychiatric treatment through medications. Now, I've said this earlier also, that psychotherapy and CBT can be best dealt by the clinical psychologists, though psychiatrists also do psychotherapies, but majorly their treatment planning is based on medication. So, whenever you feel excessive worrying, tension, stress, unnecessary stress at times that you are not able to find out because why you are stressed, so I would suggest you that you should go to a clinical psychologist initially if the diagnosis is made by a clinical psychologist as a generalized anxiety disorder, and if it is a stress or anxiety or mild anxiety, mild stress, that can be treated with CBT also, or if it is severe, extremely, where suicidal thoughts are there, loss of life can happen, so they definitely refer it to a psychiatrist for medical treatment, but treatment through medications to quickly resolve the issue. This is what happens. But CBT and medications both can also help in generalized anxiety disorders, ladies and gentlemen. It's very important to have the rightful help for the treatment for generalized anxiety, and most of the times either it is ignored or not diagnosed properly, and many of the times the diagnosis is not properly, or it is misdiagnosed with personality disorder as well. So it's important to have a proper treatment for generalized anxiety disorder. It should not be taken lightly, and I have already told you that what kind of treatment can be done for generalized anxiety disorders. So that's all about a generalized anxiety disorder. Thank you so much for stopping by, and go and research about this disorder in detail, read about this disorder in detail, get yourself educated, and I hope you have a relaxing, calming, um, experience for your treatment as well, and in general with people around you who might be suffering or might be having generalized anxiety disorder. One of the things also I would like to elaborate here, that I've mentioned in my one of my videos in panic attack or panic disorder, I think I've recorded, where I've also uh, made people aware of the coping skills, right? So what happens in generalized anxiety sometimes also, if it is existing with suppose obsessive compulsive disorder, or people are suffering from OCD, and in OCD people do have anxiety, so the reoccurrence of thought process happens, and which is actually quite dangerous. And if there is severe anxiety, loss of life can also happen, suicidal thoughts can happen in the patients of generalized anxiety, or uh, with coexistence of OCD. So I've also mentioned that along with medication, along with CBD, some you know um, lifestyle changes individuals can do in terms of sleep. Like, you should have proper sleep for around 8 hours every night. Lifestyle changes in terms of your diet, okay. What diet you should have. So you should have a proper diet prescribed you by a nutritionist, what is required for you and what's not required for you. Every individual's nutritional requirements are different, so you must and you should have a proper prescribed diet by a nutritionist, of course. And some coping skills you can develop, some habits you can develop, like the reoccurrence of thoughts when happen, you can distract your thought with something positive that can reassure you and relax and calm you. You can try taking a hot shower that point of time, which can relax you as well. And of course, some kind of activities you can involve yourself into: reading a book, listening to music, taking a walk or a jog, or suppose just cleaning your own room, or cooking, or having a chat with a friend, or taking care of the pets, or gardening, or any kind of fun activity that you like. So that will distract your thought at that point of time. So sometimes anxiety can also be not there is no particular reason for anxiety, and it still can have it still can be there, right? So these are few of the ways which you can deal with it, and of course with the proper treatment planning for the same. Thank you so much for watching, and have a great day.